Hello, I'm Sue. Welcome back to my channel. So today I want to talk about osteoporosis. And before we begin, I want to explain the specific about bone functions because osteoporosis is a symptom related to bone. It's a chronic condition. So there are 206 bones in an adult skeletal system. Bone functions as a to support mobility, protect locomotion, support locomotion, mineral homeostasis, blood cell formation, and also storing dry glyceride. So in this part, cancer also develop osteoporosis too, when the malignant tumor cell metastasize to the bone. Um, and when the persons underwent severe or prolonged potency in upper chemotherapy, like underwent used medications that really strong side effect, it also affect their bone density and lower the body mass index. So the word osteo means bone in Greek words, and porosis means small hole or cavity. So there are 206 bones in an adult skeletal system. So the aim of this presentation is to understand the definition, the etiology, the symptoms, the risk factor, pathophysiology, the diagnosis, the treatment, and prevention. So let's begin with what is osteoporosis? The International Osteoporosis Foundation defines osteoporosis as a disease that weakens bone strength, causing bone fragile or broken due to fall, injury, bumping. Osteoporosis is silently developing into bone fracture. It triggers pain and disadvantages of physiological disability to perform daily activities in daily living, and the person may lose bone density or bone strength. And around 853,600 people in Australia experience osteoporosis since 2022. And there are different types of fracture. Fractures, there are four types, including transverse fracture, displaced fracture, diaphyseal fracture, if I pronounce it correct, diaphyseal, and green stick fracture. So transverse fracture is a break where the bone is snapped straight across, perpendicular to its long axis, usually caused by high force direct trauma, commonly affecting the long bones like the femur, tibia, or the radius. These injuries often require immobility, where cast or surgery to align the bone, with recovery that take few months. So transverse fracture is a severe, okay, it's one of the severe types of fracture. Then displaced fracture, it occurs when a bone breaks into two or more pieces and it moves out of alignment, creating a gap between the bone ends. So in this case, two bone, it's got separated. And these injuries often present with visible deformity, severe swelling, and bruisings to the skin. You can observe that it's a type of displaced fracture and frequently requires surgical intervention like an open reduction or closed reduction, like a manual realignment procedure to heal it correctly. And diaphyseal fracture is a break in the shaft of the thigh bone, typically caused by high energy trauma like car accidents or falls. It's a serious injury, often requiring surgical treatment like intramedullary nailing to stabilize the bone, which boosts a high success rate. And then move on to green stick fracture. It's an incomplete partial break where a bone bends and cracks on one side without snapping completely through, primarily affecting children under 10 years old due to their softer, immature bone and more flexible bone. And the injuries that cause the green stick fracture occurs in the forearm from falls. So treatment usually involves immobility in a cast for several weeks. So all the types of fractures are common in patients and due to many risk factors. Also, these four types of fractures require treatment, and it's basically it's scaled as severe types of osteoporosis that develop into fracture. So let's get to know the symptoms. So according to Health Direct, the sign and symptom of osteoporosis may include fracture of vertebrae, the bone that make up the spine to sustain a fracture, usually the bone in the backbone. We call it like a backbone. It's like a spinal cord. So like a vertebrae, and there's a fracture there. And arm bone fractures, like in the arm bone fracture, hip fracture, hip area, pelvic area, and pain, redness or skin bruises, depend on types of fracture. Fracture is commonly separating between the cortical bones and commonly affected the hip bone area. So in this case, the sign and symptoms usually occur to the hip area. because the hip area is compromised for both trabecular and cortical bones, the two types of bone. And cortical bones support the hip bone strength. So in this case, usually elderly people, if they fall, the hip area or hip fracture is the common site that affect. So what are the risk factors? The Australian Health Institute and Welfare reported that the risk factors related to osteoporosis links to low calcium level intake and low vitamin D, being a female with post-menopause. Age factor of deterioration, example for elderly people simply fall and sustain fracture that limit the activity of daily living. The low body mass index, like a person with less than 19 kilogram per meter square, also experience prone to get of osteoporosis development. Smoking and excessive alcohol influencing early menopause and low testosterone, and that's also influencing osteoporosis. Physical inactivity, like prolonged immobility, also affect the bone strength. Prolonged using of corticosteroid medication that lower the estrogen hormone level, that also reduce bone density. Previous fragility fracture, like having history that there's a fracture in the hip, wrist, and spine, and then including morphometric vertebrae fracture. And those the person with medical history of having used to have fracture or surgical procedure, they tend to develop osteoporosis. Secondary causes of osteoporosis, including parental history of hip fracture. Again, if there's a person with hip fracture, they will develop osteoporosis easily than the other. Current glucocorticoid treatments, like any dose by mouth for 3 months or more, can lower bone density. Also, it's comorbid to rheumatoid arthritis, the joint pain, and inflammation. Untreated hypergonadism, like low sex hormone in men and women. So, and the person having low sex hormone, there's also reduce their bone density as well. Organ transplantation, the person who had history or used to transplant their organs will also can develop osteoporosis in the later age. A person with type 1 diabetes also has high risk of osteoporosis. Hyperthyroidism, like hormone imbalance, so low thyroid hormone or higher thyroid hormone. Usually hyperthyroidism, which means it's higher thyroid hormone. When it's higher thyroid hormone, the person tends to have weight loss. So that's when it can develop into bone fracture or osteoporosis due to low bone density, or too high bone density also affect or to develop bone osteoporosis due to its imbalancing and heavy bone. Gastrointestinal disease, chronic liver disease, chronic obstructive pulmonary disease. These three types of diseases influence osteoporosis too. It's as a comorbidity. Frequent falling, fall risk. Fall risk is the common due to environmental factor when the wet floor, types of slippery shoes, dark lighting, low lighting, and without notice signs, precaution on the floor or wet floor, or the floor is imbalancing or it's not it's like too smooth to easily fall or slip over. And usually elderly people, that's the risk factor, like a fall risk that influencing bone fracture and develop into osteoporosis. Poor diet and unhealthy nutrition. These are linked to nutrition factors that causing a person gradually weight loss or obesity that can imbalance their mobility, their locomotion. So that's the diet, that some sort of diet that like can reduce the iron deficiency in the body, also lower calcium level and vitamin D. So some sort of diet like what we call it, that put into the ingredient when you start cooking food. I forgot the word, but it's made from radish. So it's like seasoning, similar to salt appearance. Oh, I know, it's MSG. So MSG can reduce bone density if you overuse or overeat food containing MSG. Female patient, the risk of factor that female is more to develop osteoporosis than men because they have the risk of menopause, that ending the menopause or congenital development during their lifespan transition, the bone growth and pregnancy factor influencing osteoporosis easily. Post-menopause osteoporosis is due to onset of menopause that decline the estrogen level with the person increasing age or bone reabsorption process. And osteoclast regulated by rank ligand that activate estrogen and survive osteoblasts by marking attachments to rank. Estrogen attaches to osteoporostetrin during the onset of menopause, increasing the rank ligand, decreasing bone reabsorption, leading to vertebrae collapse. And these are the pathogenesis of postmenopause osteoporosis occurs to most female. Let's move on to compartment syndrome. So in this presentation, compartment syndrome is like an open bracket because it's a most common comorbid developed from osteoporosis after the fracture. Compartment syndrome is a painful, dangerous condition caused by excessive pressure built up within muscle groups, bone compartment, usually in the legs or arms, as seen in these presentation images. So we need to understand the pathophysiology, and then once you the information might be a lot, but the pathophysiology, understanding the pathophysiology process, you will get to know the bone healing process easier. So the pathophysiology of osteoporosis occurs when there is a bone cracking or breaking inside the musculoskeletal layers due to the injury, accidents, or the risk factor that I described previously, causing blood clot formation between the two broken bones. Triggers inflammatory response to release chemical mediators like histamines, prostaglandin, bradykinin, mast cells, and basophil. And those chemical mediators triggers vasodilations, exudate fluid and white cell migrations to the injured site, causing pain and hematoma formations. The blood clot generate fibrocartilaginous callus formation to activate fibroblasts for the bone breaching. On both ends where necrotic cartilage tissues forming in order to repair the bone. Angiogenesis form new blood vessels surrounding cartilage, and the new blood vessels replacement produce new bone tissues with osteogenesis. So the bony callus formation converts osteogenic cells into hard and rigid cancellous cells like spongy bone and bone for the bone proliferation process. And then osteoclast formation from multinucleate cells that it creates many multinucleate cells creating osteoclast creates an acidic environment to dissolve bone mineral and release enzymes to remove bone collagens from bone matrix and then fulfill the reabsorption process to reproduce osteoid. And osteoid is known as the collagen or calcium phosphate crystal inside the bone to heal and repair the bone. The bone is remodeling with osteoblast joining apoptosis to form necrotic tissues or entrapping inside the bone compartment for new osteoclast. So these are the pathophysiology of osteoporosis development. And now we have to understand not have to, but recommended to understand the bone healing process then that links to the pathophysiology, because the pathophysiology explaining might be a little bit hard to understand. So there are 4 stages of bone healing process. Stage 1 is hematoma formation. Stage 2, fibrocartilaginous callus formation. Stage 3, bony callus formation. And the last stage is bone remodeling. So hematoma formation is the first stage where the inflammatory response transport blood leakages into vascular permeability or vasodilation, causing internal blood formation due to cuts of blood vessels, and it attracts debris and infection. Hematoma formation take 1 to 7 days, basically 1 week. And then fibrocartilaginous callus formation, it's when cartilage tissues formation surrounding the fracture to breach both ends of the broken bone. And the angiogenesis forms new blood vessels surrounding the cartilage, and during osteogenesis process, the new blood vessel form cells to replace the lost blood cell that produce new bone tissues. These involve osteoid, known as collagen, and the osteoid production and osteogenic cell differentiation process can produce fibroblasts and differentiate fibroblasts and chondroblast. So this differentiation will softening the blood clot and may take 2 to 6 weeks after the fracture. And then the 3rd stage is bony callus formation, when the fibrocartilaginous callus converts osteogenic cell into cancerous cells. So it will appear like a spunky bone, like hard and rigid, and it taking like 2 to 6 weeks and more than that. Osteoblast is a woven bone formation. It growing portions of the bones, including peristem and endostem. Osteoid, like collagen, is the production of osteoblast, which made up of collagen, again, bone, mineral crystallization, form hydroxyl apatite, contain calcium phosphate, which is why people tend to take vitamin D, calcium, or collagens to have strengthening their bone. And the last stage is bone remodeling, when osteoclast formation from multinucleated cells for bone reabsorption, and osteoblast in which refill this reabsorption process. And osteoblast is made up from osteoclasts that created an acidic environment to dissolve bone mineral to release enzyme and remove bone collagen from bone matrix to then fulfill the reabsorption process and produce osteoid or collagen and calcium phosphate crystal. And osteoblasts becomes trapped inside the bone. And some osteoblasts join apoptosis to revert lining cells to cover bone and necrotic bone tissue formation in order to remodel the bones and healing it. Let's get to know the diagnosis of osteoporosis, including bone scan. So bone scan is when you scan the bone with CT scan, X-ray, or magnetic resonance imaging, MRI. Some people might, because ultrasound is incompatible for osteoporosis. So I think bone is usually like an image capture. So the diagnosis includes CT scan, X-ray, MRI, or bone scan. And let's understand what are the treatments. So the treatments include medication and surgery, analgesic medication, anaphylactic, prophylactic, immunosuppressant, antidepressant to manage pain, allergy reaction, prevent infection, boost immune system, and reduce anxiety. Consideration on anticoagulant drug that can increase the fall risk due to side effect, and with those with already used hypertension medication. It's also being careful with the drug instructions and fall risk factor. And nutrition advice on supplement and diets are also important medical intervention for osteoporosis treatment. And surgery, we have bone surgery or grafting, bone resurrection, osteotomy, cut, reshape, or realign bones, join, correct deformities of bones, and then internal fixations and external fixation. The internal is open reduction, and external like closed reduction. And we also have we call it arthroplasty. It's like a joint surgery. So these are all the two types of interventions to treat osteoporosis. And the two types of fracture fixation procedure are the open reduction and closed reduction here. I just wanted to explain a little bit about open reduction. It's enclosing the bone for surgical procedure to support bone alignment for complex fracture with rapid recovery using screws, plates, rods, and patient may experience pain. And closed reduction, enclosing bone for external manipulations to prevent infection and avoid surgery with minimum scarrings using a fixed cast, splint, and grift. Joint replacement is also known as arthroplasty. And please, you can also visit this website called the healthyboneaustralia.org.au for more detail about medication, surgery, interventions, and how to prevent osteoporosis. Now let's get to know the preventive cares. So the preventions include long-term bed rest, and increasing the reabsorption and remodeling the bone can eliminate unloaded bones. So make sure you have enough resting, precision, that correct posture when sitting, and maintain physical activity. Nutrition to support the bone like calcium, vitamins, supplements, vitamin D, drinking milk, or bodybuilding enteral diet that contains good source of proteins and calcium level, collagen, and for bone muscles. Physical exercises include weight-bearing exercise, jumping, jogging, dancing, resistance training at the gym, or balance training like yoga. But these have to be instructed careful by the supervisor. So Healthy Bone Australia has aligned with an accredited for supervised exercise program called On the Road. And this is not a promotion, but also important. If you visit the website, you will understand the prevention care and specific types of exercise to perform to improve bones health. Also, physiotherapy, occupational therapy, medical therapy also significantly reduce postmenopause osteoporosis, and they are the secondary specialists, secondary health specialists to contact to if you experience symptoms. Also, talk to your GP. And again, the diet have to be careful and with consumption of vitamins that support your bone, and drink more water to stay hydration. And thank you for watching this video. If you like, and please like and subscribe if you like the video, and see you in the next one.